just move on to the country presentations, and we propose to go alphabetically. So perhaps we should start off with Cook Islands. Rimel, you are welcome to take the floor.
Thank you, Gloria. Um, from the list of questions that was given to us yesterday, so we managed to look at the number of deaths from 2019 and compared to 2020. So, in fact, the number of deaths from the same period from January to May, there's more in 2020 than 2019. So there's a total of 34 and 40 for 2020. So it's nothing to do with COVID. And for the second question is to do with the number of births. And it's a big decrease for us for the same period from January to May in 2019. We have a total of 92, and this year we have a total of 29. And then number 3, we looked at the marriages, the total number of marriages for the same period, and it's got a big a drop for this year. In 2019, from January to May, there's a total of 192 marriages. And in this year, it's really dropped to 81. So the first 3 months of this year, it was high. When they closed the border, that's when everything just dropped. So there wasn't any marriages in April or May. So it's a nil within those 2 months. So most of our marriages are from people from overseas. So when the government closed the border, we didn't get any marriage applications here in the Cook Island. So in regards to number 4, is asking about the stats of both the dates of occurrence and registration. I suppose we are saying that we have those ones are captured in our registration system, the date of occurrence and the date of registration itself. And then number 5 is talking about the digitizing of the information. I would say that for Cook Island is partial, and it's a very low percentage of digitizing, because most of our records and informations are collected manually and done manually, and then we upload it into a database. And number 6, please indicate your upcoming projects in relation to civil registration. And some of the things Cook Island would like to achieve and complete is to digitize civil registration and vital system, and work forward to have our online registry for BDM. And this is to carry out the registration online or all online requests, for example, requesting for certificates in all 3, the births, the deaths, and marriages. Because we have a similar system that regards to the registration of companies and incorporated society, and we want to take that way, the same way, to capture all our BDM information. And then there's also a discussion going in creating a personal identity system for the Cook Island. So that's it from us.
Thank you very much, Rimel. I think we will see whether we have a session to ask questions later on, but that was very nice. Thank you very much. We will move on to, I don't know who is on the list now, but just allow me to go randomly. Palau, would you like to take the floor? Palau, are you there? Should we go for Samoa?
Yeah, we are ready to vote.
Yeah, Tarof, I came from Samoa. We have our government statistician here, the Registrar General, and the National IT Assistant Chief Executive Officer and his team, and we have our Deputy Registrar here with us. We, with regards to the question that was given yesterday, as mentioned from the brief update from our end, there's not much impact of the COVID-19 with the registration. Looking at the figures, there's slightly the same with the cooks in terms of the numbers in 2020 and 2019 for the given months from January to May. Actually, for PERFs, if we go by date of registration, we have more PERFs registered in 2020 for those 5 months than 2019. But if but there's a huge impact on the registration in May this year. What we have shared yesterday is because of the removal of the New Zealand quota scheme from this year due to the pandemic. But looking at the numbers, we had registered 1,064 on April last year, but just for this year, we were only able to register 126. Because that's the time that we experienced a lockdown, the public transportation and also the New Zealand quota scheme had been omitted from the New Zealand schedule. But in terms of deaths, it's we realized that we have more deaths registered this year than last year for those specific months that was given. It's the same goes for the marriages. In terms of the question 4, yes, we can we can tabulate by both date of occurrence and date of registration, although we have difficulties with the reporting features of our current system. But for this small data needs, we are able to tabulate by both date of registration and date of occurrence. Question number 5 is civil registration and vital statistics system digitized. It's the same as Cook Islands experience. I can say that we are semi-digitized because we also rely on manual registration, and also we have old records that are still sitting on the shelves. But luckily we had assistance from other organizations that has been from other works previously that has been done. They microfilm the data, but we are yet to look at ways to digitize all those records. For the upcoming projects, you may be aware that we have started with our national IT system project, and we just had a steering committee meeting a few hours ago, and hopefully that project will be completed in 2022, but most parts of the project will be we are hoping to complete next year before the annual election. And one of the major components of the national IT system project is the development of civil registration system. And in fact, that there's been some discussion and some work that are already in the pipeline that we are going out to not only to update the population census listing, but we also utilizing that opportunity to collect to look at ways to improve our registration, collect the date of births and all the main features for the birth registration as well as deaths. So there are works in pipeline at the moment towards the development and improvement of our current CRVS system. We also are part of that project, as mentioned, National IT Project. We are working closely with the National ID Division and with the good guidance of our Registrar General to look at ways to make sure not only update the registration how we operate locally, but we're also looking at having a reliable information system, registration system, because at the moment we can register, but there's heaps of features that we need to improve. So hopefully this project will contribute a lot, and we know that we from time to time we will negotiate, especially with SPC. We need your assistance with things for AC. You want to add?
No. Just to add on to what our registrar has been saying, Gloria, may I add on to? Are you hearing us?
Yes.
Okay.
Sorry, yes.
Just
yes,
add on to. Thank you. Just to add on to what Bonnie has been saying, I think as the impact of the COVID-19, government is planning a second stimulus package for the whole population, and in that regard, we are planning to have a mass registration in July, August. It's an opportunity that came up from as the impact of the COVID. And like Bonnie has mentioned towards the end of his briefing, that we are working with our key stakeholders and also to link this mass registration to the identity system, the work that we are currently, we've already started doing it. And we are hoping that mass registration will also use that opportunity to improve the registration, especially for children below 5, because the project is under the National ID and the Population Census. You may be aware that we are having the Population Census next year. So the work was planned for the listing of households, but due to the demand from governments for registration of population so that they are entitled to some benefits in response to the COVID, we are now integrated all those work. We are integrating the National ID project, the Population Census household listing, and then the civil registration. And this is also an opportunity for us to also link with the Office of the Election. And we are working together with them because they already have some systems, especially the biometrics, so that by the time the benefits are given out, we make sure that whoever will be listed during this registration is the same person, that they will get the benefits. So we are also working with the Ministry of Health and the Ministry of Education, just to make sure that we all share the same database that we're going to do. But the main, I think the main thing for us is actually getting registration of people, especially those who have never had a birth certificate and people who have passed on, but they're still in our system. So this would be a chance, a really good chance for us to also update our civil registration. So that's something good that came out of the COVID. I think that's all I wanted to share. Thank you very much.
Thank you very much, Samoa. Thank you. And we take note of the points that you've raised. We would like to proceed to Tonga.
Samoa and Cook Islands, we were not affected. The civil registry were not affected by COVID-19, even though they were comparing to 2019. There are a decrease in the birth and death registration, and for marriages, they're still the same. Same number from last year, even up to now. So that's for marriages. And for The registration, we have a grace period of 1 year for the registration of deaths and 3 months for birth. So with the COVID-19, we were able to extend the 3 months to 6 months to facilitate mothers of newborn to have time, ample time to come in whenever they want to register the birth, given the lockdown situation. But for death, they're just using the 1 year grace period for during this lockdown period. And moving on to digitization project, proud to say that we are the only ministry in Tonga that we have initiated this digitization project since 2012, and all our birth records have been digitized, and we are currently linked the records to the images that have been scanned. So hopefully by the end of this year that we'll be able to finish off the digitizing of all our death and marriages records. So hopefully there's no more lockdown, so we can proceed on with that. And for the project, we have this e-government project.
Sorry, Tonga. Sorry, I just wanted to ask. So what about the platform that you're using for registration?
The platform, we're just using the manual registration now. But there are plans after the lockdown that we have to move on with the to facilitate the registration, online registration. So there's a consultation with the Ministry of Health now. So they have this new health information system project. So we are currently working on it. But in the meantime, we're just using the normal manual registration.
Thank you.
With the projects, we like I said before, we have this e-government project. The government of Tonga have initiated this project with the Asian Development Bank and the World Bank. So we are expected to work closely together with the Maytech Ministry and World Bank to have this government project running. But given the lockdown situation, we're still in the lockdown mode, so we're waiting on it. But while waiting to have this project up and running, we're trying to discuss this with the Ministry of Health to see how we can validate the records that we get here in the ministry, and also the Ministry of Health, especially with the death record, because we have very limited number of death registration here in the office. So that's the e-government project. We are currently trying to revise our birth, death, and marriages registration act. There are some loopholes there, so we wanted to do this by the end of this year. And also we've had this Amnesty program funded by Unicef from last year. So there were 2 phases. Phase 1, we were able to complete this last month. And then we were able to identify 921 persons unregistered. And with this Amnesty program, we were able to register 793 persons. And the rest, we were trying our best to get them registered, but they were unbothered to attend their application. So we are currently implementing the phase 2. So hopefully those that weren't able to register in the first phase of the Amnesty program come back again to in this second phase of the Amnesty program funded by Unicef. And last project is just a revision or adoption legislation to facilitate the adoption of our children from overseas and here in Tonga. I think that's the only project that we are currently doing, the civil registry. Thank you.
Thank you very much, Tonga. We would like to move on to Sorry, I'm just looking up my participant list. RMI, are you there? And from there, we will go to Australia. Any office from Australia? Thank you.
Yes, hi everybody, it's Vivian from the Victorian Marriage Registry, Births, Deaths and Marriages. So I can only give you statistics on the state of Victoria because each state and territory is legislated differently, so they have their own systems. So I will give you just the Victorian stats for today. So we are able to register events. We're able to obtain statistics based on registration date and also date of occurrence of the event. So what I'm providing you is registered date, 2019 from the 1st of January until the 20th of May versus 2020 from the 1st of January to the 20th of May. Just before I provide you those statistics, it's worth noting that in February of last year, we implemented a new application system. And after implementing that system, because it was new to us and we were registering much more slowly, the numbers may appear to be low for 2019. What we did was after we implemented in February 2019, we obtained additional resources towards the end of May to be able to register the events more quickly because we were much slower in registering. So just wanting to let you know that is a reason why some of these numbers appear to be lower than they should be. Although we've noticed that certainly for births and deaths, the number of registrations hasn't varied very much. So COVID hasn't really impacted births or deaths. So births registered in 2019 were 27,295. And in 2020, there were 30,205 births registered. And that difference of around 3,000 was because we were registering more slowly in the beginning of 2019. Deaths registered in 2019 were 13,340 and deaths registered in 2020 were 15,828. And then marriages registered in 2019 was 8,762 and marriages registered in 2020 was 10,540. So although the numbers are higher for births and deaths in 2020, it is because we were slower to register in 2019. In 2020, for marriages, we conduct marriages at the Victorian Marriage Registry and we ceased conducting marriages at the end of March. So there have been no marriages for the Victorian Marriage Registry in the month of April and the month of May, but independent marriage celebrants have continued to conduct marriages. So that there is a bit of a difference there. And again, as I said, we can generate statistics based on the date of the occurrence of the event as well as the date of registration. Our systems are fully digitised, so parents are able to submit a birth registration online. And in fact, that was implemented last year in February when we moved to our new system. Funeral directors can also submit death registration statements online and hospitals can submit notifications for birth online, and celebrants can submit marriage notifications online as well. So we are fully digitised. In terms of upcoming projects, we are continuing to improve and evolve our system that we implemented last year. We've recently implemented a change in legislation around change of sex, and so that went live on the 1st of May, and we're making further improvements to that process. We do have a raft of improvement initiatives for our core system that we will continue to roll out over the next 6 or so months. And we're also looking at digital proof of identity and partnering with another government agency in Victoria to improve digital proof of identity when somebody submits an application for a certificate online. So there's some of the things that we're looking to do.
Thank you very much, Viv. Great stuff. Do we have someone else from Australia? Okay.
I think Anne was on the call yesterday from Tasmania, but I suspect she's not available today.
All right. Okay, so then we will move on to New Zealand. I can see Lini raising her hand. Let me hear from Lini first, and then we move on to New Zealand. Lini, you can take the floor.
Thank you. I was very interested in hearing from the registrar in Victoria that they had introduced online and that actually had resulted, it seems, in some delay, and it now took longer time. I was just wondering if she could explain why this is the case, because normally one would have expected that it would be quicker. Thank you.
Sure.
Okay, sorry, colleagues. I propose that we first give everyone a chance and then we go to the Q&A section, please.
Okay.
Is that okay? Thank you. So we will give the floor to New Zealand, please.
Thanks, Gloria, and apologies I was late joining the call, so I missed some of the context for this. I don't have the detailed statistics. However, I can report that as a result of COVID-19, we haven't seen any significant changes in birth or death registration. There were, I think so far there's been 21 COVID-related deaths in New Zealand. However, that's small relative to the number of deaths per day, which is up to 90 total deaths per day anyway, so it's a very small percentage. We did see a slight reduction in some fatalities during the 5-week lockdown. So a reduction in road-based deaths and also workplace deaths, obviously, because people weren't on the roads and people weren't working. So possibly a slight reduction in death rate, but very marginal. One thing we have been doing throughout the lockdown period was we were very closely monitoring a notification of death. So we have a 2-stage process. A GP will notify a death and record a cause of death, and then we register the death after the body has been disposed of. So there's normally a 2 to 3 week lag between the time of death and the time of death registration. During the COVID lockdown period, we started reporting on death notifications. They went online about 6 months ago, and as a result of the COVID situation, we were able to encourage more GPs to use the online service and got take-up rates much higher, which then meant that the statistics we were able to get out of the notification system were much more reliable, and we're able to basically track deaths on a daily basis, and we're still doing that and reporting that information through to a committee that I sit on, which deals with planning for mass fatality should that ever eventuate. So that was a benefit of the COVID period, was moving to basically daily death reporting rather than the standard quarterly reporting through the New Zealand Statistics Department. For marriages, we had a reduction of marriages in April and in the first half of May because marriages weren't able to be conducted in most cases. So probably about 3,000 or so marriages were cancelled and we refunded marriage licences for them, but we expect that those marriages will start up again shortly. Earlier this year, we stopped doing registry weddings. We moved that into the private sector, so independent marriage celebrants now do registry weddings, and that will continue. So BDM no longer does registry weddings ourselves. We've outsourced that function. As far as projects go, the big one for us at the moment is actually in the citizenship space. So we now have an online citizenship application process. So people wanting to become New Zealand citizens no longer have to fill in paper forms. That can be done online. Other BDM related work, because I also run the passport service, we have a whole lot of staff, about 180 staff who are no longer processing passports because no one's applying for passports. So we're moving those staff into some BDM work. So we're focusing on data cleansing. So going through our 10 or so million records and cleaning up the data. And that's preparing us for transitioning off our current life data system onto a new system sometime next year. So we'll be replacing life data and we're using the opportunity of the spare staff to cleanse what we have in the database. We've also got another project running using those same surplus staff to go back through our digitised records. So we digitised all of the old books, the old registry books. However, on each page, there are 5 or 6 records. So we've got a team of people who'll be going through those old digital records and cutting them up into individual records so that we can then automate making those records available to people who request them. Currently, we have to go through and basically cut and paste manually out of those records before we email them off to customers. So we'll be indexing to single records so that can be automated under our new operating system when it gets implemented. And that's it for me. Thanks, Gloria.
Thank you very much, Jeff. We will give the floor to Palau. Hello, Palau, are you there? Okay, I think Palau is not ready. So at this stage, I hope I've not skipped out any country. At this stage, I'll open it up for Q&A. I do have my own set of questions, but I think I will give you the opportunity to first go through questions that you have. I know Lini had one in place. Any other questions? Right. Okay, let's go for Lini's question first.
So Lini, this is Vivian Rendella Rose from the Registry of Births, Deaths and Marriages. I'm the Deputy Director for Data. So James Lawson is our Director. He couldn't make the call today. So just to provide you a bit of context, when we implemented our new application solution in February, internally, registry officers were getting used to the system. And so we weren't as fast at registering the events because we weren't familiar with how to navigate the system. So although we'd done training, the process for registering was very different to our old system. And so we were slower internally at registering. One of the other things we hadn't anticipated, up until that point, parents could only register their child's birth via a paper form. We moved to an online form in February, and parents, so the legislation says that parents have 60 days after the birth of their child to register with the registry. But what we found was parents were going online and registering within 2 or 3 days. And so we weren't quite prepared for the influx of parents registering their children online. So for us, it was more a case of having internal processes that we could use to register more quickly. So even though people were submitting online, we were just slower internally. And I think by about July, we'd recovered, and because we were a lot more familiar with the system and how to use it, we were able to register the events more quickly.
Thank you for the explanation.
Thank you, Lini. I had a few questions and I was very keen to hear about the approach that Samoa and Tonga are taking in their national ID system. Very interesting to see how Samoa, you are looking at making best use of the initiatives that are coming up in the next few months with the census, the household listing, your plans for the national ID system. I wanted to first of all ask what age group is your national ID system covering, and also to understand how are you having plans to have to adopt a new IT platform that would enable interoperability across the three databases. Generally, reflecting on our discussion about the holistic approach to the CRVS and ID system, like we discussed yesterday and the day before. Any insights on that? Thank you. And then more generally, while Samoa is probably preparing on that, it was interesting to hear about the increase in number of deaths between the 2 years, and also noting that we have not had COVID specific deaths in at least Cook Islands and in Tonga or Samoa. So it will be nice to just have a closer look at those and see what are the related causes, or what will be leading to that bump on deaths for this particular period. I'll also invite my colleagues from UNSD to contribute. Anyone there? Can you hear me?
Yes, we can hear you, Gloria.
Okay. So I wanted to first of all see whether my colleagues from UNSD have any particular thoughts to share about the discussion.
This is Sergeant from UNSD, New York. Yes, it was indeed very interesting to listen to the elaboration of the questions that we can put forward for discussion for this morning. It is evening here in New York, but then it's morning in your place. So it is really interesting to conclude that essentially, despite all the disruption that have been put in place in order to make sure that the spread of the virus is being under control, the functioning and the registration of the vital events, especially the births and deaths, did not actually had so many adverse effects in the region. And this is indeed very encouraging. However, we are also noting very much that the marriages, as we can conclude, that the number of marriages decreased significantly in this period of time. The most important point that we would like to really emphasize is that we are noting the capacity of all the countries, participating countries, to make this comparison between the monthly statistics from the previous year and the monthly statistics of this year, in order to have a complete understanding about the differences in the registration patterns of births and deaths, and then of course the marriages as well. And that capacity is really critical in order to make the full understanding and the comprehension of not only the capacity of countries to register, but also to analyze the trends and the patterns of the registration of the vital events. What I also would like to emphasize is that we are taking note, and this will be reflected in the report that ultimately will come out of this a set of webinars, these 3 webinars, and that is the point that the digitization and the holistic approach, as advocated and strongly recommended by the United Nations, is not taking full hold in all the countries participating at these webinars. It is simply the case that we are still having a number of countries that are having the manual approach, that are having distinct projects focusing only on, for example, the identity management, issuing on the ID credentials with biometric capabilities that are not necessarily linked to the functioning of civil registration and the resulting vital statistics. We are also noting that the interoperability between these three components is still not really firmly enshrined in the functioning of the governments in the participating countries. So this is something that is worth really revisiting, especially from the point of view not only of the pandemic here, but then from the point of view of making sure that we are living to the expectations of the 2030 Sustainable Development Agenda, and we are living to the expectations of legal identity for all from birth to death, which means that we need to have really a universal civil registration of all vital events, that we need to have direct link through the population registers to the issuing of the biometric credentials that will provide access to services to all individuals, and that will result in small area, comprehensive and regular vital statistics. So it is really comforting to see that the pandemic did not hurt that much the overall registration of births and deaths, to the extent, of course, it did hurt the registration of marriages because of the fact that a lot of measures regulating the social distancing have been put in place by all the governments that would prevent, of course, the marriages, the traditional marriage ceremonies that are well enshrined in the culture of the participating countries. Yet, however, there is still a lot of work, I believe, to be done, especially from the point of view, again, of the implementation of the UN Legal Identity Agenda, to put all of these components into a harmonic manner and to make sure that they are delivering the services to all the individuals in the country at the same universal manner throughout from the birth to death. It will, from our point of view, what we would like really to foster is an enhanced communication between the civil registrars, between civil and vital statisticians from the region. And to that extent, we are going to put together within the framework of the UN Legal Identity Agenda a kind of the online forum that will allow all of you to exchange your experiences and to seek advice from your colleagues, not only from the region, but also from much broader regions of the world, in order to make sure that there is a full, I would say, support and then exchange of experiences and practices that will help you out in handling not only the issue of the pandemic, but also in a much broader sense, the implementation of the UN-sponsored model. So to that extent, we will work, of course, with the SPC and the Global CRVS group, and put together this forum that will again provide an opportunity for the online exchange of posts and experiences and practices and advice, of course, recommendations to make the interchange much easier. So from our point of view, what we wanted to achieve with this set of webinars, and I believe we to a large extent succeeded in doing so, is to put together an understanding of how the impact of COVID-19 was handled in terms of the maintenance of the civil registration and the operational civil registration and the resulting vital statistics, as well as making sure that we are all aware of the fact that this is something that needs to be taken very seriously into consideration in order to enhance the capacity of countries to provide the services to the individuals as expected. So with this, I will certainly not aim at coming to any kind of very broad conclusion. I would just want to say that we believe that this has been very useful, that we heard a lot, that you heard a lot from each other, that you have a better understanding how things are going on in terms of the functional civil registration in the region, and we will then make sure that we are providing you the instruments and the mechanisms to enhance the exchange of your experiences as we move on. With this, I thank you very much.
Thank you very much, Sajan. I think I would just want to reiterate your remarks that this is our first kind of experience with sharing, allowing an exchange of sharing of knowledge and information through this kind of platform between Pacific registrars. Of course, we usually try to meet physically, but it's also nicer to be able to see and hear from you electronically and to also learn about what you're doing. Our interest, of course, at SPC is to support you to the extent possible and to be able to support you in through pooling resources from other regions of the world or other areas in cases where we feel that we do not have that capacity to support you. So hearing from you about your work is quite useful. Somehow we did take note of the points you raised about potential ways that we could work with you, and we plan to follow up on that. But once again, I just want to thank you very much for the opportunity to share your experiences. And as you would have seen in our invitation a few weeks ago, we are planning to also host a webinar on Open CRVS, and Open CRVS is an open source IT platform, and we find that information useful for countries that are a bit behind in terms of digitizing of their CRVS systems. That webinar will happen on 3rd of June, and we believe it could be useful to your countries in the event that that's the kind of a piece of support that you would like to receive. So with that, we will also try to continue engaging with you on what topics would you like to be discussed through this kind of forums, and to of course collaborate in helping you get the kind of support that you might need through this time. So with that, I just want to call the webinar to a close, and while we do, we also intend to send you a short questionnaire to basically hear your views about what was your experience with the sessions that we've had, and possibly what are some ways you'd like us to improve, or what are some topics that you would like us to address in future. But we hope that you have found this useful. So I look forward to exchanging with you over the next few days, and of course seeing you on 3rd of June on the webinar on Open CRVS, for those of you who might be keen to join on that one. So with that, I will just say thank you and invite any of you who would have some last remarks to make, final remarks to make.
Gloria, I just want to thank you and Surgeon for organising these sessions. I think the three have been excellent, and it's been really good to see how we can engage, not face-to-face and in person, but digitally across the Pacific. So thank you for the opportunity.
Thank you, Jeff.
Thank you, Jeff.
Thank you. So we did, unfortunately, we lost a few of our colleagues along the way, like from Palau and RMI, but I'm sure we will be able to reconnect on email and continue exchanging experiences. So
Gloria,
Yes, Samoa, please go ahead.
I just wanted to echo on thank you that Chief has alluded to you and Surgeon for organizing this platform to continue engaging with the CRVS development, not only in the Pacific but for the region. And we do look forward to more sessions like this to assist us with what we do and future developments that's already engaging.
Thank you, Pony. Thank you
Thank
very
you.
much.
Thank you. We will do that.
Thank you. Okay, colleagues. I think with that we will call it a day. In New York, we say goodbye. For my Pacific colleagues, I wish you a good day and looking forward to connecting with you again soon.